what I would like to talk to you about today is novel strategies to support the value statements that you need to create for payers and providers when data are scarce. This is largely a problem of smaller medical device companies, but it also happens to large ones every once in a while, especially in certain product lines. So I think everybody's probably familiar with this problem, and hopefully I can provide you with some resources and some thinking about how to attack the problem when you have scarce data for making that value statement. Okay, here's my presentation outline, the points that I'd like to make. First of all, I want to talk just a little bit about, and probably this topic needs no introduction, but just a little bit about the demand for comparative effectiveness and cost effectiveness data. Two situations in which manufacturers' data are often scarce. There are a number of situations, including PMAs, when you've got your product approved by PMA, I mean. Some unconventional sources of data that you should consider. Methods of analysis for dealing with this data, because when you're looking at unconventional sources of data, we're usually talking about observational data. And as we know from those evidence rankings, observational data usually gets second shrift to randomized controlled trials. So let's talk about ways we can compensate for potential bias in those areas. And then I'm going to give some examples of cases that I've worked on for products that used uncommon data sources, and I'll give summary and conclusions.